We often hear that healthcare is becoming increasingly hard to manage and that real change is near impossible. What does this mean for healthcare leadership? The strategies we have used up until now have gotten us exactly to where we are today, a system that is in desperate need of innovation. It is time for new thinking and approaches that embrace the complexity of our healthcare system. Welcome to SEEK's Healthcare Leadership Development Program. This program is for physician and non-physician healthcare leaders and is unique in that it focuses on our healthcare system as a complex adaptive problem. In such a world, the way forward is often not obvious, but through deeply engaging the people who are so-called touching the problem, the people who are deeply immersed in that system, the way forward starts to emerge. Through 5 highly interactive and engaging 2-day CEPD accredited sessions held on weekends, healthcare leaders learn how to understand and influence a system that at times often seems bewildering.
There are lots of parts of leadership that I've realized that aren't intuitive. So for example, thinking of the healthcare system in terms of complex adaptive systems, the whole concept of frontline ownership and ownership, not buy-in, using liberating structures to organize meetings and to get initiatives going. Those are the key frameworks that I now have going forward that I never did before this course.
In addition to classroom work, participants also take advantage of peer and one-on-one executive coaching. Alongside coaching sessions, there are ample opportunities for participants to learn from their peers and apply newfound knowledge back in the workplace.
The executive coaching is something most certainly I intend to continue on because it's allowed me to kind of bring up the learning to a level I hadn't anticipated I'd be able to bring it to.
Informal learning was really influential. So the learning from my peers' experiences, their difficulties, their conflicts, the networking from our teachers and coaches, all of those interactions that were really informal, had a huge benefit and impact.
Over the course of the program, participants work with their coaches on an action learning project. The idea behind this is they're finding a difficult to solve problem and then using the tools and approaches that we learn in class to try to solve it. At the end of the year, they present their findings on posters, and it's one of the most popular parts of this program.
To go home and really allow people to develop an ownership of that change, to have a real stake in the system itself, and that their solutions may be the most important way that we can achieve that important change in the complex system.
This program is unique. It will change how you think, and it'll change how you practice. Hi, I'm Michael Gardam. Nice to meet you.